Yeah, so my name's Adele and I'm a dietitian here at HealthPoint. So dietitians support patients at HealthPoint by essentially helping them set goals and also recognize what they want to work on, understand how foods affect their health. I like to talk a lot about foods that can be added into the diet and understanding which foods are, not necessarily going to support our health goals, but can still be kept in reasonable quantities, and looking at planning healthy eating and nutrition in ways that consider people's preferences, that consider their budgets, that consider their cultural backgrounds. It's really about coming up with a plan together and finding something that works for them that they're going to be able to stick with in the long term. Culturally relevant care means to accept that people of different backgrounds have different preferences for what types of foods they eat. It can be tricky to use certain language because we don't want to demonize certain foods. And we know we don't want patients to overdo it on those foods, especially if they have diabetes or issues with blood sugars. But at the same time, we don't want to kind of talk negatively about a food that's important to somebody in a certain way. So just looking at being mindful of what things are relevant to them, what foods they're often interacting with, and understanding patterns, but also just practicing cultural humility and understanding while I might know a lot about nutrition, there's a lot about their culture I don't understand, so coming up with a plan together